I want to welcome all of you again. We're honored to have such a diverse panel of leaders. I'll provide a more detailed introduction of each panelist as we move forward, followed by their individual comments. And then we're going to save as much time as we can for question and answers, with a combination of questions we received in advance and ones that can be submitted during the event. So speaking of, don't be shy. Type any questions you have into the chat feature on your screen. You can open chat by clicking on that little icon at the bottom that looks like a cartoon bubble. Since we only have 60 minutes for the discussion, I'm told my other role is to keep the time moving so that we get through everything we want to talk about. So if you don't mind, we're going to get started with remarks from our county executive. Along with his leadership team, the CE has been working around the clock to support Baltimore County residents through the COVID-19 crisis while continuing to do the business of moving the county forward. I know the CE is both grateful and proud of the support our federal delegation and community partners have provided to help meet the needs of our residents. So, Mr. County Executive, we would love for you to kick off our discussion.
Great. Thank you, Terry. Really appreciate that. I want to thank you and your team for organizing this webinar and for bringing everyone together for this discussion. I also want to recognize the leaders that you already mentioned on this panel, including our great Senator Ben Cardin, who has been working tirelessly to help bring resources back from Washington to us in Baltimore County and frankly to all the jurisdictions of the state. Senator Cardin has been so committed to helping us that when the CARES Act passed, his staff literally hand-delivered our application in Washington to ensure that it was received and processed. So thank you, Senator Cardin, for your leadership, as well as the other leaders in this panel who are doing incredible work around the region and the state. I want to thank all of you who are listening in to make time to be here. Thank you for everything you have done and are doing to support our communities during this unprecedented crisis. Since the beginning of the crisis and of this pandemic, our administration has made it a priority to grow and expand our work with the nonprofit community. And now we've gotten to a point where our relationship with the nonprofit community has become an essential part of all that we do. We know it's upended the way we live our lives for residents, nonprofits, and government alike. So when COVID-19 hit, we took an all hands on deck approach to support our residents and manage the public health response. We began reaching out to nonprofits in the community to figure out how we can work together to improve the lives of our residents. And I want to thank all of the nonprofit and community partners who quickly jumped into action. They've just been an incredible resource and partner and an asset for the county and our residents. Together, we're making sure that we have our residents meet their basic needs like food and shelter, and our nonprofits are playing such a critical role to ensure that need is met. We've been able to rapidly scale up countywide food distribution, connect more residents to benefits, and do more to help our residents with things like eviction prevention. With the help of the Maryland Food Bank and other nonprofits, in partnership with our school system, we've delivered almost 5 million meals to residents. We're doing food distribution 6 days a week in every corner of the county, and it just wouldn't be possible without the nonprofit community, the National Guard, and BCPS. With so many residents facing evictions and hardships, we want to provide a bridge to those who need it. So with Terry's leadership and his team, we created an eviction prevention program to help those who are struggling. And we're also working with the Fair Housing Action Center to provide financial coaching and counseling for those who need it. So we're doing the basic needs, but we're also managing a health crisis, doing things like getting more PPE for our first responders. We set up a COVID-19 emergency fund where we've tapped into the philanthropic community and provided over $400,000 for nonprofits, in addition to groceries for those food insecure families who are partnering with nonprofits. We've also partnered with nonprofits to streamline some of our services and make more resources available. A few weeks ago, we announced a new partnership with the Cash Campaign, where our residents call 311 to schedule a free benefit screening for over 20 different programs. So it's all about making it easier. We're working around the clock. We know that even more needs to be done. So we're expanding our outreach efforts to coordinate with, for example, our immigrant community partners. We want to partner with all of you to make sure we're filling the gaps and providing services. So we're thankful that Baltimore County is home to so many dedicated community partners who are stepping up and helping meet the need. This is an unprecedented crisis, but we are and we will get through this together. So again, thanks to everyone for your work to improve the lives of our residents. And thanks again to our incredible group of panelists who are great partners and doing great work out there. Thanks, Terry.
Ben Cardin. Oop, had to unmute me. Sorry.
That was a great introduction. I loved it.
I knew something. What would it be without a technical glitch? Thank you, Mr. County Executive. And next we are going to hear from the Honorable Ben Cardin. Senator Cardin has proudly represented Maryland in the United States Senate since 2006. Before that, serving nearly 20 years in the U.S. House of Representatives. A third-generation Marylander, Senator Cardin knows firsthand how COVID has affected Baltimore County residents, businesses, and community partners. Senator Cardin and our congressional delegation have helped to secure federal COVID funding for Baltimore County's fire department to purchase PPE for over $422,000 for Maryland legal aid and over $200 million for Maryland schools. As Maryland's senior senator, he is a tireless federal advocate for county residents and the nonprofits that serve as the foundation of our local safety net. Welcome, Senator Cardin.
Well, Terry, thank you for the introduction and thank you for what you're doing. And to the county exec, as I said to you before we got started, I'm a proud resident of Baltimore County. Thank you for your incredible leadership during COVID-19. Your messaging has been clear. Your actions have been decisive. You have saved lives in Baltimore County, and you have energized all of us, whether it is your government partners or whether it's a nonprofit community. So I'm very proud of your leadership. I think it's been a model for other regions of our country to follow your example. So thank you for that commitment to the people of Baltimore County. I want to make a few points, and that is the nonprofit community is critically important for those of us in government and carrying out our mission. That was true before COVID-19, became even clearer during COVID-19. But the most important thing we can do to help our nonprofit community, the most important thing we can do to help the people of our community, to help our economy, is get this virus under control, to listen to our public health experts, to follow the right recommendations in regards to what we need to do on distancing and wearing a mask and testing, et cetera. And we've had that leadership in Baltimore County, but that's the most important thing we can do is to get that done. And I'm very disappointed. We've seen the inconsistent messaging coming out of Washington, the lack of preparation, and the list goes on and on and on, not making PPE available, not having enough for testing, et cetera, which has made Baltimore County's job more difficult. It's made the nonprofit sector more challenging. And so I just really want to start with that. Secondly, we need to help. And Congress did the right thing when it passed the CARES Act. It recognized that for us to deal with this pandemic, we have to do a Marshall Plan response to the pandemic itself through public health capacity and our healthcare providers. And we provided that in the CARES Act. We have to help state and local government. And we did that in the CARES Act. We have to help individual families. And we did that during the CARES Act by providing refund checks and providing unemployment insurance. We did all of that, and we have to help our businesses, and we passed extraordinary measures to help all businesses under the Paycheck Protection Program for small businesses. I'm the ranking Democrat on the Small Business Committee. I'm one of the architects of that program. My top priority was to make sure nonprofits could qualify under the PPP program, and they did. We were able to get them help on their payroll for 8 weeks and some other expenses. And many nonprofits took advantage of that, and that helped them. But you see, when we passed the CARES Act, we thought that this pandemic would be behind us by the summer. We didn't anticipate that it would be a continuing problem into the fall. And that's why in mid-May, when that became apparent, the House of Representatives passed the HEROES Act to provide the next round of help for state and local governments and for our community. Because we recognize for all of our stakeholders, including our nonprofit community, that you need to have partners. You can't do everything for our community on housing and healthcare and education and food. You work in partnership with the other stakeholders, and government's a critical partner. But government revenues have been decimated. In Baltimore County, look what's happened to the income tax revenues, with so many people unemployed. What's happened at the state level with the sales tax revenues, with people staying at home. What's happened as far as the hotel taxes and car rentals and things like that to reduce revenue, all decimated. So we need to help our state and local partners. That's in the HEROES Act to provide substantial help to Baltimore County and the jurisdictions of Maryland and the state of Maryland, about $15 billion in total over the next 2 fiscal years, the state and local governments. But we need to do more. We got to help families buy unemployment insurance. Otherwise, where does the families get the money to pay their basic needs? We have the nonprofit community. God bless you, but you're being stretched right now because your resources are being tapped, and quite frankly, your demand is much, much greater. And then what happens to protection against foreclosure or eviction that expired? The HEROES Act provides significant help for renters and homeowners to protect against eviction and foreclosure, because it's the right thing to do for our community. It's the right thing to do for the banks and for the landlords, but it also provides us relief from people being out in the streets that put more pressure on the nonprofit community and government community, and you don't have the capacity to deal with it. That's all in the HEROES Act. I could go through the entire list of all the different programs that are included, including nutrition programs, including the Postal Service, including election issues, including our schools, all providing help. The bill should have been enacted in May. The Senate's now in recess until September. We need to take up the HEROES Act in the Senate and pass it so that we can have a full partnership. And yes, there's the next round of help for our business community, the next round of small business relief. I'm going to tell you, Senator Rubio, Republican, chairman of the committee, I'm a Democrat, ranking Democrat on the committee. We'll give you a bill within 15 minutes once we're allowed to bring it to the floor. We'll work together in a bipartisan manner to help small businesses and help nonprofits. But we got to get the bill on the floor, and Mitch McConnell needs to bring it up. To date, he's not doing that. So, my message is pretty clear. Thank God we have the nonprofit capacity in Baltimore County and the state of Maryland. You do incredible service to the people of our community. We all got to be strong to get through this. And we have to provide the resources we need for the county services, the state services, the nonprofit community, and the private sector. And we're working to do that as your federal delegation, get these issues before the United States Senate. Thank you.
Thank you, Senator. That's some really important insight, particularly about the importance of government and nonprofits working together. So let's shift a bit from federal to a state and local perspective. We're joined by the distinguished economist, Dr. Darius Irani. As the Vice President of Strategic Partnerships and Applied Research at Towson University, Dr. Irani fosters the development of a strategic collaboration between business, government, and educational institutions that contribute to the economic vitality of the greater Baltimore region. Additionally, Dr. Irani serves as chief economist for the Regional Economic Studies Institute at Towson University, a policy group providing economic, fiscal impact, and policy analysis to state agencies, nonprofit organizations, and private sector firms. Dr. Irani, I think data and the ability to make decisions based on real-time information is so critical in this time, and something that our county executive and leadership team have turned to time and time again. We're so glad you can be with us today to share this unique perspective on your analysis of the situation. Welcome.
Thank you. Thank you, Terry. Thank you, Honorable Senator and County Executive Olszewski. It's a great honor to be here. As an economist, I've had the good fortune of studying these many business downturns, and we are facing unprecedented economic challenges of historical proportions. I mean, this goes back to the Great Depression. The challenge really is that this is, of a pandemic in nature, unlike the past recessions where it was an asset bubble bursting, overpriced housing. This is one in which the federal government, the state government, the local government said, hey, we need to shut down businesses until we can get this virus under control. We need to start wearing face masks. We need to do physical distancing. We need to do testing. We need to get PPEs. All these things sort of, shut down our businesses, which were exactly the right things to do. But we needed stronger, consistent policies from our federal government to make sure these were effective. Unfortunately, we have sort of, slacked off on this, and you can sort of see these around the country. This is the federal government needs to take an active role, as Senator Cardin has indicated. We need to be supporting unemployed individuals. We need to be supporting businesses, households, state and local governments. You know, just by not funding the extra $600 a week, we're taking $50 billion out of the economy every month that for households that would spend that money back into the economy. So households who are out of work would immediately take that money and spend it back, you know, buying groceries, paying rent, all those good things. So this is critical. I cannot emphasize how critical it is for us to get something passed to help our economy recover. This is a role the federal government needs to play. Just to put it in perspective, you know, our GDP declined by 32% annualized last quarter. Our investment is down by 49% annualized. We have only 5 million job openings, yet there are 20 million individuals unemployed. There's a 50 million job opening gap. We have over 1 million unemployment claims this past week. You know, compared to, this is so off the charts. In the worst days of the Great Recession, we have about 685,000 claims per week. 1.1 million is considered to be a little bit high, you know, compared to what it was before, but compared to the 12 million we had in weeks prior. For Maryland, we've been hit hard. Our first quarter gross state product was down about 5.1%. Now we'll lag the national data. We saw that, you know, our unemployment numbers were 7.6% unemployed, 54,000 new jobs. But remember, we also have 200,000 continuous claims compared to just under 50,000 pre-COVID. We as economists have sort of done some long-term forecasting and sort of looked at sort of Maryland and sort of over the next three years, we sort of are predicting that about 200,000 jobs will be lost. Now, gradually we'll claw those back, and about $25 billion lost in gross state product over the next 3 years. So there are some unprecedented challenges. I, you know, fully endorse that we need as an economy federal government intervention. This is the time when the federal government needs to spend money supporting our small businesses, our unemployed workers, state and local governments who again are coming into this crisis, you know, already challenged, and now this crisis has put extra pressure on their budgets, which means that, you know, next year or the year after, they're going to have to make some harder decisions. And again, this crisis was caused by a health situation. This is exactly the role the federal government needs to play in, is to sort of help prop our economy up and guide us through this calamity. And thank you very much. And
thank you, Dr. Irani. Let's continue with this theme, and let's continue to drill in locally. I'd like to introduce you now to one of our own local experts, Momin Akbudir, who is Baltimore County's first Chief Data and Performance Officer, leads the administration's data-driven good government initiatives, including the implementation of Baltimore County's first countywide performance management program and open data initiative. Momin and his BC Stat team have been integral to the county executive's COVID response, providing access to real-time information that has enabled data-informed decisions to protect and support county residents. And I think how we dig into this data is going to be critical to how we address what's coming ahead. So, Momin, welcome.
Thank you. Again, I don't really need to introduce myself any more than that. Thank you for that introduction. Really, the purpose of BC Stat, if you could start the PowerPoint, please. But the purpose of BC Stat in this specific area is to pretty much bring data to any area where decisions are occurring. And the county executives have stressed that since the beginning of this program, and we focused a lot on departments and specific priority areas such as opioids and the opioid crisis. And then, like all of you and the most of you, we had to sort of pivot towards the COVID-19 response. And so what we did is we switched gears and we provided data analytical support to a lot of various groups within local government. We supported the Emergency Operations Center with the senior staff, the county executive, the health department, the communicable disease program, food distribution task force, and the individual and family benefits and engagement work group. Next slide, please. So I wanted to go through some of the ways that we sort of did this, provided this support. So we started off by really creating real-time data dashboards for our Emergency Operations Center. We looked at various different data points. And one of the hardest tasks was deciding what data was worth tracking, and how to track it, whether it was partnering with the IT department and having an ad hoc database that was for that one specific purpose, or just getting a bunch of different spreadsheets that we had to consolidate and create into different visualizations for our EOC. So just running through really quickly some of the different dashboards that we had. We had the county COVID-19 data, which was obviously the cases, the deaths, the locations of where things were occurring. We had meal distribution data. We acted as a central repository for all of the various different food distribution that was occurring in the county, and we put it in one consolidated dashboard. We tracked all of the PPE inventory within the county. We looked at the health hotline calls that were coming in. We helped the social distancing task force, where we partnered actually with the University of Maryland Transportation Institute, and got some mobility data to be able to be a little bit proactive with our enforcement, especially with masks and social distancing. Next slide, please. We also looked at pretty much one of the things that I skipped over there was we looked at sort of the stress on our normal day-to-day operations and our first responders. So we looked at the number of calls coming in for police, fire, EMS during this pandemic to make sure that we were able to sort of handle any sort of overload to the system. We also looked at, obviously, and what we're showing here is we consolidated all of those various different dashboards into a dashboard of dashboards, a summarized dashboard. I know it's blank because a lot of this data is confidential, but this is sort of part of, it gives you a general sense of the information that the county executive and the senior team and the EOC and the health department are looking at on 2 to 3 times a week and can have access to on any given day or any given time. So we look at the number of new cases that are added, cumulative cases. We look at the 7-day average for deaths, 7-day confirmed case average. We look at the percentage of deaths related to long-term care facilities. And this is a really surprising number, but a lot of people don't know that about 80% of our deaths are related to long-term care facilities, whether it's nursing homes, assisted living facilities, et cetera. We look at the number of days where we've had decreased hospitalizations, our ventilator utilization in hospitals, our surge capacity, our inventory days remaining for the majority of our important PPE items, whether they're gloves, surgical masks, N95 masks. Next slide, please. We also look at the number of occupied ICU beds. We look at the number of ventilators in use. We try to predict different ways. We try to predict whether or not we're going to have an influx of cases by patients under investigation being transported by our EMS department to hospitals from both in general the community and then also long-term care facilities. We look at obviously our positivity rate, again, inventory levels, the number of employees that are teleworking. We look at the number of our staff that are either in isolation, quarantine, especially regarding our first responders. And then we, at the very bottom, look at some social indicators such as SNAP applications, unemployment claims, and meals distributed. Next slide, please. So I wanted to show just a couple of slides on how we drill into this data. And again, so we have sort of those first 2 slides that I showed, and then we have some graphs. And again, this is just the population tested. We've had 21.5% of our population tested, and our positivity rate currently sits around 3.6%. Next slide, please. We look at, again, the hospitalizations for COVID-19 patients, and we break this down even further by the various different hospitals. So we know when there's an uptick, which hospital, which area, et cetera, and we continue to track this. And again, this was very instrumental in deciding, for the county executive and his team deciding for when to reopen and whatnot. Next slide, please. And then finally, we slice and dice the data in so many different ways. We looked at, for example, this is the age distribution of cases in blue, and then also deaths, which are in red, by month since the beginning of this pandemic. And you can actually see how it sort of skews to the left to the younger populations as the pandemic sort of progressed. And you see, all the way in August, where the largest age group is actually the 18-year-old age group. And again, this is very important because we continue to track this as schools are reopening and whatnot. Next slide, please. So we also support, again, this is the health department. What we did is we spatially analyzed a lot of these different clusters of the cases, identified hotspots, and that actually informed where we distributed a lot of our safety kits. We also identified areas where we thought the testing centers should be based on the cases. Next slide, please. We also supported Yeah, sorry. With food distribution, we identified areas that we thought were the most food insecure based on the mileage to the closest grocery store. Next slide, please. And in the interest of time, for the benefit engagement work that we did, we've been working very closely with Terry and his team to try to come up with eviction projections to see sort of what the district court filings will be for failure to pay rent. And we're trying our best to sort of project that based on various different other variables. We're looking also, we obviously don't want it to get to this point, but we're still looking and trying to be as prepared as possible by looking at the demand at our shelters and the capacity of our shelters, in the event that a lot of individuals do become homeless. And again, we're looking at all of this data to help inform the decisions that are made within this administration. I believe that concludes my presentation. Oh, sorry, I just wanted to add one last thing. If you do want access to some of the data, we do have a public-facing dashboard that's available at that link where you can get some of the data that I have mentioned. Thank you.
Great. Thank you, Momin. I'm going to do a little PSA now because I hear that our chat room is not filling up. So if you're struck by anything, you want to get first in line for a question that we can address during Q&A, just please click open your chat box and put it in there, and we will get it out to the panel. So moving on, we're going to finish with two nonprofit leaders, with the idea being to get a real sense of what's going on out there, and then in the Q&A and discussion, try to blend all of this together during a conversation. Up next is a friend, colleague, and dedicated servant leader, Mitch Posner. Mitch has served as the executive director of the Community Action Network, also known as CAN, since April 2019. This longstanding county-based organization operates two of the largest shelters in the county, as well as transitional and permanent supportive housing, food pantries, and a number of additional critical services. Mitch, I know your teams are out there working every day in the field, and you've got one of the best clear sights of vision of what's going on. So we're eager to hear your thoughts and observations. Welcome.
Yeah, thank you, Terry. Thank you so much. I'm really honored and pleased to be here to represent our clients, our incredible staff of essential workers. We heard that term a lot earlier in the pandemic, but CAN has not closed for 1 minute since the pandemic started, and our staff's been on the front line. So yes, I bring you observations from what we see here every minute of every day in the areas you described. I want to start though by acknowledging and reinforcing what both the county executive and Senator Cardin had to say earlier on. First of all, I want to directly thank you, Terry, and your team, Dr. Branch, who you've worked with as it relates to the safety of our residents and guests at the shelters and the staff at the shelters. Everybody should know that Baltimore County immediately helped us relocate. I think it was 60 or 62 people who were in the shelters who were most at risk due to age or underlying health conditions into hotels. And so then subsequently, we've been working to move people out of the shelters into permanent independent housing with the help of the county. So actually, we've helped 78 people, guests of our shelters, move into permanent independent housing in the crosswinds of this pandemic. And also, I've been working with Elizabeth Sachs and her team, the Emergency Food Task Force that the county executive stood up immediately. And I am overwhelmingly impressed by the ability of the county to get up and running these distribution centers that have, as I think the CE said earlier, have fed over 5 million meals to people in the county. And Senator, I just want you to know that the financial aid that came through in all the different programs that you mentioned earlier has absolutely positively helped CAN directly and indirectly. So first of all, we, for one, are a recipient of a PPP loan, which helped us keep our staff fully employed and funding some other things that we're doing. With the unemployment insurance benefits and the $1,200 checks and all of that has absolutely kept our clients solvent and with the ability at least to make choices of which bills to pay. It's still not enough to pay all their bills, but at least they've been able to make some dignified choices. And so I could go on, but let me tell you, so as Terry said, CAN runs very large homeless shelters. We run the largest food pantry in Baltimore County, at least compared to up to 200 partners of the Maryland Food Bank that exists in Baltimore County. We have a transitional housing unit for men, women, and children. We have 27 units of permanent supportive housing. We are one of, if not the largest, eviction prevention funding source or helping source in the county, again, thanks to partnership with Baltimore County government. And we have 5 outreach centers across the county that help people with budget counseling, applying for benefits such as food stamps or SNAP, and so forth. So we very much sit in the intersection of the 2020 storm, the perfect storm, if you will, of all the different winds of both the historic, persistent economic, racial inequities in our economic system, and now where they are meeting the terrible impact of COVID-19. That being said, let me start just telling you a little bit about what we've done by reading you an email that I received last Sunday evening. My name is Abigail, and I reside in Parkville, Maryland, 21234. I'm laid off due to COVID-19, and I'm currently struggling to make ends meet. I need help with my rent and food as I am buried under debts and insufficient funds to help sustain. I'm in need of help. I won't be able to make rent next month, and I still haven't paid this month's rent fully and had to drop my fall semester classes because I can't pay my tuition. Is there an application I can submit, please? So my great team jumped on this, and we are very much in the process of helping Abigail pay her actually it'd be her September rent. But I wanted you to know that she is one of 125 households that we are helping avoid evictions so far. Since March 9th, we're at about 125 households that we have helped avoid evictions. I think I mentioned earlier, we've helped 78 of our guests at our shelter move into permanent independent housing. So that's been a huge success for us. And to dramatize the food insecurity issue, so our pantry is open 5 days a week, 5 hours a day. In the course of time since March 9th up till last Friday, we'd seen 3,300 people come to our doors, and we've provided over 207,000 meals worth of food through our food pantry. Now, none of this could be possible without the partnership that we have with Baltimore County, the state of Maryland, and the federal funders of our CSBG funds and other sources. But it clearly, I feel like I'm getting close to the cliff, staring at an abyss, because as all these CARES Act funding sources come to a close, both for the individuals who've been receiving benefits and for the county government, my understanding is must spend those funds by December 31st. So come this winter, as more people get further behind in their rents, and we're seeing people talking to us who are 3, 4, 5 months behind in rent. We're seeing people who absolutely don't have enough food to put on the table and think about the holidays coming up, Thanksgiving, Christmas, New Year's, etc. And then we look at heating bills, utility bills beginning to be increased as the winter sets in, and that's a huge need that's been unaddressed. So all of that, when you combine that with the lack of jobs, as was reported earlier, the deficit in jobs, and even if you have a job, the child care challenges that we know are very real for our clients, I think it's really looking rather bleak in the months and maybe year ahead. So we would appreciate and value and benefit from any and all partnerships, any and all funding sources, because I can't imagine it'll be enough, no matter how much might be forthcoming. Thank you.
Thanks, Mitch. It's a sobering picture, one that we know and we experience every day, but to hear it in one place brings some reality. Let's continue with that. Building on that unique practitioner perspective, we're now going to hear from another colleague, Renee Davis. As supervising attorney at the Maryland Legal Aid Bureau, Renee works alongside community advocates and promotes the involvement of Maryland Legal Aid's Baltimore County office in community outreach activities. In these challenging times, Maryland Legal Aid continues to be the largest provider of free direct legal services in Maryland, a dedicated nonprofit serving specifically county residents, delivering civil legal services to low-income folks all across the state. Renee, welcome.
Was muted.
There you
Again, once again, thank you for having me here. Again, just piggybacking off of what Mr. Posner said, Maryland Legal Aid has been in the trenches since the beginning of this pandemic. We provide free legal services to low-income people in the state of Maryland, where we are a statewide private nonprofit law firm, and we provide free civil legal services throughout the state to 23 different counties. We have 12 offices located statewide. During this pandemic, we never closed. We always remained open. Our buildings were closed, but we were consistently working with our clients via telephone and also online. So our goal was to always remain in the trenches with the residents of Baltimore County. The type of legal services that we provide assistance with, specifically housing, family law, consumer, government benefits, unemployment, healthcare, are those necessities that we're speaking of today that a lot of our residents in Baltimore County have been impacted by this pandemic. This pandemic has impacted these benefits. One of the things we have been seeing since the pandemic is an increase of assistance being sought for evictions, housing, landlord-tenant issues, assistance with receiving unemployment benefits, and also healthcare. One of the things that we've found is that even though eviction prevention funding is available, it's a limited amount. And so we're kind of the office of last resort. When Mr. Posner cannot help those clients that have fell behind with their rent because it's so much, they come to us because they're facing evictions. Luckily, the moratorium the executive order through the government has prevented the evictions, but as we're all aware, as of July 25th, that executive order expired. And so we're expecting a trickling effect of evictions increasing over time as the courts phase into different dockets. And so our goal is to make sure that we partner with as many nonprofits in Baltimore County so that they're aware that we're here. So when you're unable to provide any assistance via financially, food, or assistance with applications for SNAP, also unemployment, that we're available to be advocates for the residents of Baltimore County. One of the things that we're finding as we progress in this pandemic is that tenants are now beginning to be harassed by landlords. Landlords are now contacting us regarding bankruptcies because they're facing foreclosures. Also, we're seeing that there's delays in receiving unemployment benefits. And so we have to, on behalf of the clients, try to see if we can expedite that. You have an overlap. A lot of the clients are coming to us with 2 and 3 problems. It's layered. So one of the things I hope that we can continue to do, which we have been doing with the county, is create this holistic type of system where we continue to partner together so that we can triage these issues that our residents are facing and streamline that process, because it's going to take all of us working together to make sure our residents in Baltimore County is assisted and helped as much as possible as we can. Another thing that I think is important that we think about is also, I believe that the onus is on us to make these resources that we're talking about accessible to the residents and to make them aware that it is out there and that it's available to them. So our goal at Maryland Legal Aid is to continue to let the residents know in Baltimore County that we're here. We're going to be here. Our doors opened on July 27th to our physical building for them to walk in. And the reason we did that was because we thought it was important that we open our doors for walk-ins is because everyone doesn't have accessibility to technology. Everyone doesn't have accessibility to a computer, especially with the libraries being closed. And also telephones. A lot of our clients are using government issued phones. And so they have limited amount of time and minutes per month. So we wanted to make sure our clients are aware that we're there for them. They can walk through our doors and we're here to help them any way possible with any type of civil legal services.
Thank you, Renee. You know, as a former law professor, it seems like a very long time ago, I think it's really important that this is shedding a real light on the importance of legal services for vulnerable individuals, right up there with providing food and other basic needs. Society has gotten that complex. So you were all very efficient speakers, by the way. So we have a full 20 minutes for questions. And I have a couple starters. We have a couple that came in from the chat. And Senator Cardin, if you don't mind, I'd like to jump in. There's a very straightforward question that I just got in that simply says, we're out here and we're frustrated watching these things develop and we see where things are going. What can regular people do to help move our representatives forward on this support agenda in Congress in the most effective way possible?
Well, first of all, let me thank the panelists. I thought the information was extremely helpful, and thank you all for your service. You all have a lot of credibility in the community. You're representing nonprofits. You're meeting with your supporters. Explain to them the circumstances. When you take a look, for example, as to what Congress needs to do, you hear from the professor that these are unprecedented times. It requires major response from the federal government, not just around the edges. We got to do things that are consequential. And when you listen to how the nonprofits are responding, you recognize that they need to have a strong state. They need to have a strong county. These resources need to be there, and they're not there today. So try to get beyond the politics of Washington that are being used to say that we're affecting real people's lives. We have people who need housing. We need protection against eviction, yes. We also need resources in families so they can pay their rent. That's got to be done. These are unprecedented times. I think you can give credibility to this argument to try to take it above the type of politics that the president is trying to reduce this to, so that we do what's right for our country. And it's right for our economy. It's right for all of us. And I must tell you, I started by saying getting this pandemic under control. Everybody benefits from that. It saves lives, but also saves businesses, saves jobs. So I think we all need to make this point as loudly as we can. And the bottom line is weigh in. This is a democratic country. We are on the verge of a national election. Let your voices be heard, both for how you feel on these issues and make sure you participate in this election.
Thank you, Senator Cardin. We have another question that came in from the chat, and this one for you, Mr. County Executive, and I think it perfect segue from the senator's comments just now. Question is, if the HEROES Act or similar legislation does not go through, what's the county going to have to do? Will it have to consider laying off employees? How's the county going to make up for lost revenue?
Thanks, Terry. And I'll just echo the senator's comments. In a word, yes. I mean, we are facing really dire budgetary circumstances. And I want to, again, thank the senator and all those who were members of Congress that supported and passed the CARES Act. For Baltimore County, it was $140 million of support so that we could stand up the testing, the contact tracing, the PPE, the housing eviction prevention, the business support, all the things, the legal aid, all the things that we know that we need to sustain and keep our county moving forward from a public health perspective, but also from an economic and just quality of life health perspective. Without those dollars, we would be really hamstrung. We, in our budget cycle, have reduced about $150 million from the baseline, what we thought we would be spending as we closed out fiscal 20 and entered into fiscal year 21. So we're talking significant reductions. I believe the cuts that we had to work with the county council to enact in this year's budget cycle was the largest amount of cuts that they have ever enacted in at least recorded history on the council. So we're talking about big numbers. We are currently at maintenance of effort budgets for our school system, for our libraries. We had our employees push off and they got no COLAs included in this year's budget. We were fortunately able to stave off any furloughs and layoffs. But to the extent that the economic challenges that Dr. Irani mentioned continue, that we see, more challenges, we're going to have more difficult choices about how do we balance the budget, because we are obligated to have a balanced budget. Just for context, I mean, this always stuck with me. In the first 3 weeks of the economic fallout of the pandemic, there were as many unemployment claims in Maryland as there were through the entirety of the Great Recession. So just let that sink in for a second in terms of what people are facing. And so we're not immune from that. To the extent the CARES dollars, at a minimum, the CARES dollars can be repurposed to help us fill our budget gap. That will be helpful. To the extent it can be spent beyond the end of the year, that will be helpful. But really, again, as has been pointed out, this crisis is not going to be over at a hard stop at the end of the year. So the more resources we have, the better we'll be able to keep meeting that need locally from a public health, from personal wellness, from a business support perspective. So the stakes are real. And again, we have some great leaders out there like Senator Cardin, like our community advocates on this panel, who are telling the stories about why this is needed, but it's really dire if we don't have other solutions between now and then.
Great. Thank you, Mr. County Exec. I'm going to read a question that just came in, and then I'm going to use my prerogative as moderator to kind of add in a question for our nonprofit providers, because I think this gives some great context. So the question we got in chat is, not-for-profits are, almost to a fault, people-driven, built around interacting with others and structured to reach those most in need, all while being unable to carry over additional funds from year to year like most corporations can. How do you anticipate being able to help those nonprofits that are crucially involved in meeting with people through the reality of COVID-19, because it won't be going away anytime soon? And Mr. CE, what I want to do is I want to add a question that we had on our list and direct it to Renee and Mitch first, which is, how are you dealing with the realities of social distancing and other restrictions in what is essentially a caring, face-to-face, contact-driven business? How is it impacting you, and what are you doing? And then we'll come back to this larger question, Mr. CE, of supporting nonprofits.
Okay, I'll go ahead and address that. As far as Maryland Legal Aid, the first step was making sure our staff was safe and making sure that we had the PPEs and the logistical setup in our office to make sure that our staff could actually return to the physical buildings. Because we thought it was important, because we are a community-based law firm, we're people to people, face to face, we wanted to make sure that we continue that. So we first had to address the safety of our staff. Secondly, we had to reach out to our community partners and stakeholders to see how we can be of assistance to them to continue to do community outreaches. We do have a unit that is specifically for community, and they have came up with phenomenal ideas on how to continue to do outreach. We are in the community. We're still conducting outreaches via the internet and also in person. So we make sure our community advocates have PPEs to protect themselves and also the potential clients. We are also on social media. We're letting people know we are here. We never left. We're on Facebook. We are doing lunch and learns every Tuesday at noon for clients to call us, ask us any questions they have. That's on Facebook. We're pushing on Instagram. Any interaction or questions you have, you can reach out to us there. So our goal right now is to let the community know we're still here, we're still available to help you provide legal assistance. So that's been one of the things that we've been really doing right now is letting everyone know, hey, we're here, we're still here. And if we have to come out to the community, we're open to that, of course, safely. So we always want to make sure that dialogue is there with our community partners to see how we can get creative and still provide the same services pre-pandemic, during pandemic, and post-pandemic. So that's how we've been able to address that. But again, like I said earlier in the introduction, on July 27th, we open our doors for clients to walk in. So we're still face-to-face with the clients.
Great. Mitch, anything to add to that?
Yeah, first of all, let me just acknowledge that Renee and Maryland Legal Aid and CAN are partners, and one of Renee's attorneys who we had a pre-existing relationship between our organizations. So I think in coming to grips with dealing with the pandemic, that was very valuable to both of us because we were able to immediately transition to electronic and telephonic, connections. But we had, a trust between our staff. And I know Dave has been very helpful in a number of cases that we've been dealing with, eviction related. So a couple of obvious logistic things that we did, and we knew that we couldn't stop handing out food to people who depended on us at our food pantry. So we have not had a client inside our building since March 9th, but we have seen 3,300 clients at our front doors. So we have 2 front doors, one of which now has plexiglass shield, and our intake specialist sits behind the plexiglass. The client shows their driver's license and other ID up to the plexiglass. We take down some information that we need. We enter it into the HMIS center system. They get approved. They go to the next door where I have to tell you, a volunteer who happens to be the chairman of our board has missed about 4 days, wearing masks, wearing other protective equipment, helping people, handing boxes of food, bags of frozen meat, and other essential items, to any and every taker who comes. So we've with the help of the Maryland Food Bank in the county and federal funding, we've been able to really stock up our warehouse at our pantry. The shelters, as Terry knows maybe better than I do, we've really, because we haven't taken any new admissions under the advice of the Baltimore County Health Department, our census right now is very low. As I said, we've moved a lot of people into independent housing, which is probably the safest place for them to be. And we're working with Terry and his staff to determine how we can reopen at a diminished capacity, but safe environment. It's a tough challenge when you basically are living in a dormitory type environment, bunk beds, head to foot, side to side. So we're looking at probably cutting the capacity of these shelters in half, I guess, Terry, right? So, and the eviction prevention and the other outreach benefits work we're doing is all being done via fax, via telephone. So we do have these outreach offices scattered around the county. We haven't been in any of those physical locations, but we have handled the increased volume of calls. I think we get about 275 calls a week on average during the pandemic that are handled by our 5 outreach officers. So.
Great. I want to turn back to the county executive with thoughts on supporting nonprofits. And then I think with the few minutes we have left, I have one specific question for Momin and Dr. Irani, and then a kind of a closing question. So Mr. CE, thoughts on assisting nonprofits in their work?
Yeah, I mean, just generally, I'll say, the value of our nonprofit partners cannot be understated. The only way we were able to distribute 5 million meals to date is because we have such great community partners. We're bridging the gaps because we have, folks who have the relationships in the community, who have their own networks. So it's critical that we find ways to support our partners. We're trying to be creative in doing that, whether it was the $400,000 we already mentioned through our COVID response fund, which was ultimately, those dollars were meant to be operational support for many of those doing works in the community. In other places, we're saying, where can we use our care dollars on things like food to help amplify that work? And then how can we sort of bolster and surround them on things like eviction prevention, on other places where they're doing work where the county can come and surround that or be a partner on benefit screening. So we're really trying to find, it's been encouraging, frankly, to see that there's more that we can be done. I think having the CARES money has been really helpful and impactful. people have been grateful or very generous, and we're grateful for how generous they've been to support the COVID response fund, which has been a vehicle for us. It's never enough, though. I mean, nonprofits are already sort of operating as efficiently as they can on very small budgets. And so we know this has just exacerbated the problems. And so we want to make sure, just as we're keeping people from losing their homes and their businesses, we can't afford to lose our nonprofits because they're already sort of helping us fill the void. And if we lose that out of the ecosystem, we're really in trouble. So I could probably go on, but I've got a few other questions I want to get to before we're wrap.
Great. So let's get to data here quickly, because you have a large audience of nonprofit leaders on this webinar right now. So Dr. Arani and Momin, we spend a lot of time internally talking about what data we can track to predict what's coming. You have lots of nonprofits in the community that are on the front lines interacting with people. Any advice for them on what they should be doing with data collection, ways we might work together better to try to get our hands around what's coming and how to best deal with it?
Jump in pretty quickly. So one of the whenever you see data analysis, especially with regards to a lot of these different issues, you're going to see a lot of census data being used, and the majority of the time it's almost always census data, and because of that, there is a component that you can't really drill deep as you want to get into a local jurisdiction or a specific neighborhood as you'd want to with the census data. So the one thing that I would ask that has been very helpful for us in a lot of the work that we've done is pretty much, double checking, doing quality checks on what the census data is showing. So for example, if, we would look at, for example, how many households in a specific census tract, are individuals who are renting and then renting with and contributing more than 30% of their income towards rent. So there's all these various different data points that are available by census tract, but it would be very helpful to know the individuals that you're actually dealing with. One, how many months behind are they on rent? Are they teleworking or telework eligible? What is the extent of their food insecurity? Is the food that they're receiving at food distribution sites sufficient for the allotted time? There's a lot of these questions that we sort of really want to find out and double check sort of our census data to be able to get a better sense of what's happening in specific neighborhoods and the customer base that the nonprofits are sort of reaching out to.
Great. Dr. Arani, anything you want to add?
Sure. So I would just, reiterate what Momin said, was that basically it helps validate some of the census data, which in and of itself is already obsolete by the time, we see it. So having data out there or be able to look at it allows us to, as Momin done, to do some predictive analytics of where do we need to set up the next testing station, where do we need to provide more legal aid, all those other things. So it's critical. From our own forecasting point of view, we do some scouring of some of the unemployment ads and kind of seeing what the skills are needed. But if they can begin collecting data and providing it, especially the county, I think it's critical because that helps allocate ever more scarce resources to help address the challenges the county faces.
Great. Quick example, I think, is in the eviction prevention phase 2 that'll be conducted by many of our nonprofit partners. The county's developing a portal for all the applications to come in so that we're able to track that data uniformly across all those platforms. It's just like a moderator to throw out a deep question right at the end of a panel, but I think it's worth asking. And that is, as I go around and talk to community leaders, what I hear is the coronavirus may be something new, but the economic ills that are being exacerbated by it have been with us a long time. And we're going to be fighting them at different levels for the foreseeable future. What is, and I'll throw this open to anybody who wants to leave us with some strong thoughts, what are potentially some of the positives that could come from all of this turmoil with the extra funding, relaxed regulations with housing, innovation driving us to do certain things? Can we come out of this with some wins for people by taking advantage of what's here is the final question.
Well, Terry, first let me again thank you and the county exec for putting this together. Before COVID-19, we knew vulnerable people were vulnerable. They're challenged with housing, they're challenged with nutrition, they're challenged in education, they're challenged in the economy. And we know that we had these disparities in this country. Some of it's systemic problems, some of it is opportunity gaps, but we know that. And that's why we all work together to help our vulnerable communities. When you go through a downturn, whether it's COVID-19 or economic downturn, whatever it may be, vulnerable people suffer the most. So if you look at the Great Recession of 2008, we had a wealth gap in America before the 2008. It grew during the 2008 recession. Poorer people did much worse than wealthier people. But here's perhaps the silver lining in COVID-19. We already made available through the CARES Act over $2 trillion. We're negotiating a package that will probably be somewhere between $1 and $3 trillion on the next COVID relief package. If we are smart in the way we use that, we can help bridge the gap. For example, digital divide in education. If we can really make broadband available to every household, that will go a long way in dealing with a lot of the challenges we have. If we can use the COVID-19 to deal with the disparities we have in access to healthcare by creating capacity in underserved communities, that will make a difference. On the economic front, we're looking at building up financial capacity within vulnerable communities so that when you use a PPP type program and you need to find a 7A lender, they're already in your community. You don't have to create them as we've been trying to do during COVID-19. So if we can make the fundamental changes by using COVID-19 related funds to build up capacity within minority communities, within vulnerable communities, we can come out of this perhaps building a stronger America.
Thank you, Senator. I think that's a good call to action for us. Mr. County Executive, anything you want to add before we close?
Again, I think the senator is right here, and this crisis has laid bare what we've already known in many ways, and so we should use this with, we should ramp up the fierceness of our urgency, and then also hopefully use these resources and this flexibility and the desire and the need to innovate to make these systemic changes that are going to actually get us where we need to be for all of our communities that have been underserved. So, and we look forward to doing that with all of you. Thank you for listening in today.
There you go. Great. I see Jasmine has posted contact information in the chat. So if you need to get a hold of people individually that spoke today, can't thank our panelists enough, including our elected leaders. And there'll be more of these conversations. Thanks for coming out and joining this one today. Take care, everyone. Be well.